Assalamualaikum, my name is Hafiz Iskandar. So today I'm going to explain to you guys about plyometrics. Plyometric is a type of exercise that train muscles to produce power. In case you guys don't know what power is actually a combination of strength and speed. Plyometric exercise involve a stretch of the muscle immediately followed by a contraction of the same muscle, which is why it is sometimes referred as jump training. Believe it or not, this plyometric exercise or training is an important component for professional performance. Right now I'm going to talk about the benefits of plyometric training. The first one is enhance your strength and speed. Every athlete wants to increase their strength and speed. Even if you're not a professional athlete training full time, it doesn't mean you cannot benefit this plyometric training in your daily life. Okay, plyometric is a great exercise because the movement of that training or exercise can help you to increase your muscle power in arm and legs. Next, it can increase your endurance. Plyometric exercises are great for building muscle, but they also help with an athlete endurance as well. The third one is it can burn calories. I know that running and other aerobic exercise will help you to burn your calories, but why not you try to do the plyometric training, because you can also increase your strength and speed. By increase your strength and speed, it will enhance your performance in burning calories at a faster rate. And last but not least is develop your abilities in other exercise or sports. We all know with a great power come a great performance. Okay, all the previous benefit of the plyometric training listed above has been an attractive addition to many an athlete training performance, especially for those whose sports require explosive movement, such as weightlifting, soccer, and basketball.
Metabolic response. First, increased buffering capacity. Second, ability to neutralize acidity. Third, ability to produce ATP without O2. Fourth, the body become better at storing phosphocreatine and carbohydrate in the muscle for immediate generation of ATP for energy without oxygen. Better storage equal an improved ability of the ATP-PC system to work at a higher intensity. Fifth, the activity of the enzyme that break down phosphocreatine, creatine kinase, synthesize and break down ATPase and help break down glucose to form lactate are increased. The improved breakdown of phosphocreatine especially help extend the capacity of the ATP-PC energy system, which help during strength, power or speed performance. Cardiovascular changes. First, the muscular walls of the heart increase in thickness, particularly in the left ventricle, providing a more powerful contraction. The left ventricle internal dimension increase as a result of increased ventricular filling. Second, the increase in size of the heart enable the left ventricle to stretch more and thus fill with more blood. The increase in muscle wall thickness also increase the contractility, resulting in increased throat volume at rest and during exercise, increasing blood supply to the body. Third, as cardiac output at rest remain constant, the increase in stroke volume is accompanied by a corresponding decrease in heart rate. Fourth, cardiac output increase significantly during maximal exercise effort due to the increase in SV. This results in greater oxygen supply, waste removal, and hence improved endurance performance. Fifth, people with blood pressure in the normal range experience little change in BP at rest or with exercise. However, hypertensive people find that their BP is reduced toward normal as they do more exercise. This is due to a reduction in total peripheral resistance within the artery and improved condition and elasticity of the smooth muscle in the blood vessel walls.
Respiratory and muscular change and adaptations. Adaptation can be seen at rest, during submaximal work, or during maximal work. There are factors that influence the adaptation, that is, type and method of training, for example aerobic versus anaerobic. Next, frequency, duration and intensity of training. Individuals' capacities, which is hereditary factors or genetic makeup such as fiber type, either slow twitch or fast twitch, and somatotype such as ectomorph, mesomorph, and endomorph. Fitness level, gender, and age also can be a factor of this adaptation. Respiratory. With plyometric training, adaptations during submaximal exercise generally include an increase in tidal volume and a decrease in breathing frequency. While during maximal exercise, both tidal volume and breathing frequency increase. As we can see at the slide, adaptation in pulmonary ventilation (VE), which is minute ventilation, decrease at submaximal intensity and increase at maximal intensity. In pulmonary diffusion, minute ventilation unchanged during rest and submaximal intensity, but increase at maximal intensity due to lung perfusion. Arteriovenous oxygen difference, or AVO2 difference, increases as muscles now are able to efficiently use more oxygen, so it involves submaximal and maximal activities. Muscular adaptation or change. There are two types of training that influence in muscular change and adaptation. It is endurance training and resistance training. There are two types of fibers that involved in endurance training, which is slow twitch and fast twitch fibers. Capillary bed density also happen during this training. Trained muscle possess a higher density of capillaries than untrained muscle, which permits a greater blood flow with increased delivery of nutrients. Resistance training causes increased muscle size, or we call it hypertrophy, through an increase of myofibril size and the number of fast and slow twitch fibers. Moreover, the recruitment pathway of muscle fibers become more effective. Resistance training thus leads to greater force development of the trained muscles.
Okay, hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Akif Hidawi Rosli, and I will talk about hormone response. Okay, firstly is regular and action. Regular action is maintaining blood sugar glucose during exercise. Glycogenolysis is the breakdown of the liver or the muscle, which is a glycogen store to glucose. Okay, second is gluconeogenesis, which is a synthesis of glucose from amino acid, lactate, glycerol, and other short carbon chain molecular. Okay, next is plasma glucose is increased by the combined action of glucagon, epinephrine, norepinephrine, and cortisol. Okay, lastly is increase during exercise and promote glyconeogenesis, and glycogenesis is increased amount of glucose, and it is available for use as an energy sources. Okay, next is what is the relationship between hormone and exercise. Exercise present a pointer stimulus for hormonal adaptation. For example, RT or resistance training, that acute program variable. There is 5 program, which is intensity volume, rest interval, rest selection or sequence repetition velocity. Other than that, frequency aerobic, plyometric, sprint and agility training. Also have 5 types, which is intensity, volume and duration, modality, workout, which is rest ratio and frequency. Okay, next is what is other variable affecting for hormonal response. There is 5 factor, which is genetic predisposition, gender, fitness level, nutrition intake and potential for adaptation. These 5 factor will influence your hormone. And lastly is hormonal effect. The effect a hormone exerts on a tissue is directly related to the construction of the hormone in the plasma and the number of receptor available. That's all from me. Thank you.